Moving to the next vaccine tier is also raising some concerns that greater access could make it harder to get a shot. The county has already warned that it will take a while to reach everyone. ABC 10 News reporter Jared Aarons takes an in-depth look at some of the concerns doctors have as this rollout continues.
Teachers, police officers, food service, and other essential workers will have access to the coronavirus vaccine. March 15th, access expands again to people with certain pre-existing medical conditions. That means by the middle of the month, millions more Californians could be eligible to get vaccinated. Doctors say that is great news, but it brings with it a lot of challenges.
I love that the patients will be able to get vaccinated, but it's a huge tier.
Dr. Ghazala Sharif, the chief medical officer for Scripps Acute Care, says getting as many people a vaccine as possible is crucial to ending the pandemic. But she feels new rules from the state are too vague and too broad to be practical.
And how do you prioritize one patient over another? You can't do that.
She's talking about this bulletin from the California Department of Public Health, which says people under 65 with cancer, kidney disease, pregnancy, obesity, or a half dozen other conditions can be vaccinated starting March 15th. But Dr. Sharif says there's not enough supply for that many people.
That's a lot of people, and we don't have the vaccine to get it to everybody. And so it's going to cause a lot of angst and a lot of unrest, I think.
It's a concern shared by Dr. Christian Ramers with Family Health Centers of San Diego, who says his clinics only get 20 to 30% of the vaccines they ask for.
And when you increase the pool by so many people, it's going to be a crunch for those of us that are vaccinating to try to serve all those people.
Help is on the way. Tuesday, Pfizer announced plans to provide 13 million vaccines per week by mid-March. Moderna says they'll have 40 million a month starting in April, and the FDA could approve the Johnson & Johnson vaccine by the end of the week.
We are now targeting delivery of the second 100 million doses of our vaccine by the end of May, and a third 100 million doses by the end of July. A full 2 months ahead of schedule.
Meanwhile, some people say the list of pre-existing conditions didn't go far enough.
I'm a cardiac patient. I have a stent. I do have breathing issues at times.
Janet Silva has lupus, which led to several other health issues. Lupus isn't on the state's list, nor are many other severe diseases like type 1 diabetes or hypertension. People with those say they need the vaccine too.
And it scares me because I have carotid artery issues and I have heart issues. And it's like, well, how is that less important than a kidney? How is that less important than someone with asthma?
The state's health directive gives people like Janet hope. In addition to the specific illnesses, it says doctors can use their clinical judgment to assign a vaccine to anyone who is, quote, likely to develop severe life-threatening illness or death from COVID-19 infection.
I think in the end, it is a good thing. We don't want to increase restrictions. We want to increase vaccinations.
But Dr. Sharif says it puts physicians in an awkward position of deciding who else can and can't get a shot. She calls it another emotional burden doctors must bear in the pandemic.
You might as well not have criteria. You might as well just say 16 to 64 if that's the case, because I can almost guarantee you there's an out for almost everybody.
Bottom line, March is going to be a busy month on the vaccine fronts. Doctors tell me they hope their patients can show a little patience as we all work through this next phase of the rollout. Jared Aarons, ABC 10 News.
Now, Scripps says they will reach out to patients when it's their turn to get a shot. People going to a superstation will need to provide a letter from their doctor explaining why they're eligible under the tier system. Now, we have more information on the vaccine rollout on our website, 10news.com. We'd also like to answer your questions about the coronavirus vaccine. So if you have concerns or maybe an experience you want to share, just send us an email at tips@10news.com.